Hello! Welcome to today's lesson on the use of radiation in cancer treatment. Today we will learn that radiation therapy is a cancer treatment that uses high-energy radiation to destroy cancer cells. Then we will understand the types of radiation therapy and draw a distinction between internal and external radiation therapy through detailed comparisons. Finally, we will consider the side effects of these treatment measures and how these are managed and controlled. So far, you have learned about radiation damage, contamination, and various uses of radiation, including in PET scans and as tracers. Building on this foundation, we can now delve into how radiation can be used to treat cancer. This concept will advance our understanding of physics by showing how nuclear processes can have powerful medical applications. Let's get started! Radiation therapy is a vital and widely used treatment for cancer that employs high-energy radiation to target and destroy cancer cells. This high-energy radiation can be in the form of gamma rays, which are directed externally at the body, or alpha and beta emitters, which are placed inside the body through ingestion or implantation near the tumor. The primary mechanism through which radiation therapy works is by damaging the DNA within cancer cells. DNA is the molecule that contains the instructions for cell growth and division. When radiation damages the DNA inside cancer cells, it disrupts these instructions, preventing the cells from growing and dividing. Without the ability to divide and grow, the cancer cells eventually die. There are two main types of radiation therapy. We'll go through these one by one. The first of these is internal radiotherapy, or brachytherapy. Internal radiotherapy involves placing radioactive sources directly inside the body. These radioactive sources are usually beta emitters. Doctors strategically place tiny radioactive sources inside the patient's body, close to or within the tumor. These sources are often encapsulated so that the radiation can precisely target the cancer cells while minimizing exposure to surrounding healthy tissue. The close proximity ensures that only the tumor gets a high dose of radiation, which helps in reducing the side effects commonly associated with radiotherapy. The other form of radiotherapy we are going to discuss is external radiotherapy or teletherapy. External radiotherapy involves directing radiation from outside the body towards the tumor. This method employs high-energy beams, such as gamma rays, delivered by a machine called a linear accelerator. The linear accelerator emits precise doses of high-energy radiation beams aimed at the cancerous area. External radiotherapy uses advanced imaging techniques to ensure accurate targeting. The machine typically delivers many low-strength beams from different angles, each converging on the tumor. This approach ensures the tumor receives a high cumulative dose of radiation, while each individual beam is relatively weak and thus less harmful to the surrounding healthy tissues. Advanced technology allows for precise control over the radiation dose and its delivery path, maximizing the damage to cancer cells while sparing nearby healthy tissues as much as possible. While the primary target of radiation therapy is cancer cells, normal cells surrounding the tumor can also be affected. The high-energy radiation doesn't distinguish between cancerous and normal cells, so it can damage both types. However, normal cells are generally better at repairing this damage than cancer cells. Despite this, radiation therapy can lead to various side effects. A common side effect is fatigue. Patients often feel extremely tired during and after treatment. Another common side effect is skin irritation. The skin in the treated area may become red, sore, or itchy. Another side effect that may occur is damage to nearby organs. Depending on the location of the tumor, nearby organs might be affected, causing symptoms like nausea or difficulty swallowing. Due to these side effects, doctors closely monitor patients undergoing radiation therapy and adjust treatment as necessary. Sometimes the radiation dose or schedule is modified to ensure the treatment remains effective while minimizing harm to healthy tissues. This careful monitoring helps maintain the balance between destroying cancer cells and preserving the patient's quality of life. Modern advancements in radiation therapy, such as intensity-modulated radiation therapy, IMRT, and image-guided radiation therapy, IGRT, have increased the precision with which radiation can be delivered to tumours. These techniques allow for higher doses to the cancer cells while sparing more of the surrounding healthy tissue, thereby reducing side effects. In today's lesson, we discuss the use of radiation in cancer treatment as part of our broader study of atomic structure and the uses of nuclear radiation. We began by understanding how radiation therapy targets cancer cells, destroying their DNA to prevent them from reproducing. We also discussed the types of radiation therapy and drew distinctions between internal and external radiation therapy through detailed comparisons. Finally, we looked at the side effects of radiation therapy and how medical professionals manage these effects to ensure treatment effectiveness and patient safety. In summary, this lesson helped us see the practical and life-saving applications of nuclear radiation in medicine.